Great. So welcome everyone today. Thank you so much for joining us for this webinar to learn more about the beta cell elements of the type 1 diabetes Grand Challenge. And we're specifically going to focus today on the translational program grant call that's open. And that's being administered by Diabetes UK, but obviously we work very closely in partnership with JJRF and with our very generous donors, the Steve Morgan Foundation, who have given the £50 million that's made this Grand Challenge programme possible. We just wanted to clarify that if you do have any questions on the causes Grand Challenge, we're more than happy to connect you with our colleagues at JJRF who will be able to answer any questions that you may have. Before we get going, there's a couple pieces of housekeeping. So we just ask that you please switch off your cameras and stay on mute whilst we're recording the webinar. That would be fantastic. We will upload a recording to our website, so the Type 1 Diabetes Grand Challenge website. And we will, of course, not include the Q&A. It's just going to be our presentation. When we get to that section, please do feel free to come off mute, put your camera on. We really want to have a discussion, hear your feedback on the call, answer any questions that you may have. But if you do have any questions whilst we're presenting, anything pops into your mind, do feel free to pop it in the chat. And my colleagues will be collating those so we can get through as many of them as possible during that part of the presentation. So I just wanted to take the opportunity to introduce the team, so particularly the funding experts here from the Diabetes UK arm of the Type 1 Diabetes Grand Challenge team. So we're joined by Chandrabala Shah, who's going to talk to you about the assessment criteria for this call. Rachel Jones, our Research Funding Officer, who's going to go into a bit more detail about the application process itself. Carmony Shah, our Head of Research Funding, who'll be leading the question and answer session and the feedback session too. And finally myself, Jess Sutcliffe. So I've joined Diabetes UK as the Beta Cell Programme Lead. And yeah, looking forward to learning more about all your wonderful ideas as to how to address this call that's currently open. We just wanted to remind you that there are still 44 days to pull together your expression of interest with the submission deadline of the 28th of April. With VDOIs, expressions of interest, it's all about a snapshot of your idea. It's about really capturing how you think you and your team are best placed to answer this element of the beta cell therapy Grand Challenge. Before we get into the details of the translational program call itself, we thought it might be helpful just to take a little bit of a step back and think about the beta cell therapy Grand Challenge as a whole. So we have assembled a beta cell scientific advisory panel. So this is composed of independent world-leading experts in the space who are advising us on how best to invest the £30 million we have available for beta cell therapies. We've had so many conversations with them. There's been a lot of back and forth. Should we fund lots of small projects? Should we fund one £30 million team programme? And the conclusion that we've come to is actually it would be really beneficial to invest across that research pipeline. So we're really thinking about innovation. So do watch this space for future calls around short, high risk, high reward projects and other models of enabling collaborative, multidisciplinary, innovative research. But obviously you will have noted that innovation, high risk, high reward, that language is also used for this translational call. And we definitely are very welcoming of that to be embedded in these programs. Our translational aspects itself, so that's what we're here to talk about today. So these are longer programs of work which have multiple work packages and are complex and are really thinking about actually translating these ideas further towards the clinic and thinking about patient benefit. And also not being like, we don't want to miss an opportunity to start thinking about how do we test these emerging therapies, what's needed clinically within the UK to enable that to happen. So that's something that we're thinking about. That's something we want to engage you as a research community about as well, to make sure that we're doing everything that we can together, working with you to really expedite the process of getting these therapies to people living with type 1 diabetes. And finally, thinking about collaboration and community. So that's something that we think is absolutely essential for this. So we are also thinking about how we can enable that, how we can bring people together, how we can bring new perspectives into this field and enable that multidisciplinary approach. And a really good example of this is actually investing in future leaders in this space. And we had a senior research fellowship call last year, and we'll be announcing who's been successful and been awarded those grants later this month. So do look out for that announcement. So now honing in on the translational program grant call that's open. So thinking about the scope and the eligibility. So this call is all about providing the injection of funds needed to fast track these burgeoning beta cell ideas towards the clinic. And we have two themes. The first theme is about the design of beta cells fit for transplantation. So we would really encourage you to think about stability after transplantation. So that can include cell longevity, thinking about cell functionality over time, and also thinking about continual insulin production, but also thinking about protection. So that's not just about the fact that you're transplanting a foreign cell into a host, but also thinking about the autoimmune process itself and how you can prevent that from being reactivated. We've listed some approaches here. These are by no means what you have to stick to. These are just some ideas. These are things to kind of stimulate and give a flavor of the discussions that we've had with the scientific advisory panel. So this could include host modulation, so thinking about including immunotherapies with transplantation to protect those transplanted beta cells, maybe manipulating the microenvironment itself, so making it a more hospitable location for these transplanted cells. Thinking about modification of the beta cell, so could genetic engineering play a role here? And finally, thinking about novel transplant approaches such as location. We did have a couple of questions about this that we just wanted to address. So one of the questions that come in was around the use of deceased donor islets. So we would be open to the use of cells from those, but we just want to reiterate that this really is about beta cell transplantation. So it would really need to be justified as to why that is the best approach, and also demonstrating how it's kind of not incremental, but really is moving further than what's happening with the cadaveric islet transplantation network. So it really is honing in on that beta cell transplantation aspects. Our second theme is about regeneration. So once again, this isn't exhaustive, just some ideas. Could we think about novel methods for replication? So if there are beta cells that are remaining, how could we stimulate them to repopulate? And or cell conversion. So as I'm sure you're all aware, there's some early studies around being able to encourage cell type switching from alpha cells to beta cells. So we're really open to kind of what you think could be innovative and disruptive in this space. We also wanted to stress that there's no right way of addressing this call. So we've given you kind of the broad scope. You don't have to just address theme 1. You don't just have to address theme 2. It's about really pulling together a competitive application that you think will answer this challenge. And we're really open to hear from you as to you think what aspects are the best to focus on. Honing on a few of the other questions that we've had. So one of the questions that came in was around whether the use of human samples would be viewed more positively over in vivo and in vitro studies. We are open to the use of in vitro and in vivo studies. If that's what's required, we would just really ask you to consider how that relates to the setting in people, so in humans. So actually making sure that there's a justification as to why that's the right approach to be taking, and also thinking about like that clinical relevance, like thinking about how that's helping us move forwards towards therapies for patients. We also had a question around what's the endpoint for these programs. So we're not requiring these programs to end in a clinical trial. We appreciate that that would be incredibly ambitious. However, if you think that that's possible and you think that you can get there, maybe starting or want to start thinking sooner rather than later about that early stage trial if things go to plan, please do. And we'd be more than happy to chat to you about that further. And finally, we had a question, multiple question, which talked about the cost of therapies, ethical issues, whether repeated interventions are needed, and what kind of duration of effectiveness we're looking for. And we kind of want to push that question back onto you. It's really, you're the experts in this space. It's about what you think is feasible and what we think will be best for people living with type 1 and allow us to make progress sooner. We also think it's always useful to kind of cover what's out of remit. So just for clarity, we won't be accepting applications that are focusing on identifying or stratifying those at risk of type 1, looking at the prevention or improving the diagnosis of type 1 diabetes, or addressing the complications of type 1 diabetes. We also wanted to stress that it shouldn't just be pilot or feasibility studies. There should be a much broader program of work with multiple work streams and objectives. And also it shouldn't be a small part of an early phase clinical trial. So yes, please do, if you want to embed that aspect, as I just mentioned, in your programs, but this program should be a bigger piece of work, bringing researchers together. And on that, there was a question around kind of high risk, high reward research. We really are open to that. We want high risk, high reward approaches to be embedded within the programs. And that's actually something that as we assemble the review panel, who's going to look at these grants, which Chandrabala is going to tell you a bit more about later on, we actually want to work with them to make sure that we're all comfortable with that as well. Like, we want to enable a review process that is accepting of risk and is actually embracing of that as well. And finally, the last thing that we can't support is refurbishment costs or infrastructure costs or capital buildings maintenance costs. We've also tried to give you some loose requirements, so thinking about eligibility, just to think about what we're looking for in this call, what we've heard from the SAP, and how we really want to start building this type 1 diabetes grand challenge beta cell community. So we've tried to make sure there's a level of flexibility. So you are eligible to apply as an individual if you're an independent clinical or non-clinical group leader. And if you apply as an individual, you can apply for up to 1.5 million. However, we're also open to collaborative proposals. So that would be jointly led by up to 3 non-clinical and or clinical group leaders. And in that situation, you can apply for up to £3 million. We also ask that you're taking a team approach, so thinking about the co-applicants and collaborators who will be involved. So co-applicants, some funders might also refer to these individuals as co-investigators. So they are not leading the program, but they might be making significant contributions to the delivery of a work package or work stream or element of the program. And then collaborators who in our mind are playing a smaller role. So perhaps they're helping to answer a very specific question in one of those work packages, providing intellectual insight, maybe providing services, providing access to equipment or specific skills or expertise, maybe potentially for an assay that you would need in this setting. Grants can be 3 to 5 years in duration, and there's no benefit in applying for 3 over 5. We just once again wanted to have that flexibility to allow you to put your best foot forwards. And we're really open to involvement of researchers in Europe. So we ask that the principal applicant is based in the UK, but if you are going to apply for that collaborative grant that's led by up to 3 independent group leaders, then those 2 joint lead applicants may be based within Europe. And we're also open to collaboration, so collaborators being based further afield, especially when you're thinking about connecting with networks or biobanks across the globe. It's really about pulling the best people together to answer this challenge. And with that in mind, we've really tried to emphasize the value of multidisciplinarity. We know that's challenging, but we would really value bringing new people into focusing on type 1 to help strengthen this community and bring different perspectives into the beta cell therapy challenge. So once again, these are just some examples, but you could think about bioengineers, so actually thinking about ways to protect those beta cells during transplantation. What's the best kind of medium to transplant them in? Clinicians, making sure you have that clinical voice, that patient perspective, really thinking about how you would actually move this forwards and get this to patients in the future. Immunologists, potentially people who aren't currently working on type 1 diabetes, but maybe we're focusing on other autoimmune conditions, or perhaps even diseases such as cancer, who are very relevant and transferable skills. Stem cell scientists, not focusing on type 1, bringing them into this challenge area. Chemists, surgeons, the list goes on. We're really open for as many expertise as possible and the right people to solve this challenge. And with that in mind, we're open to the involvement of industry, whether that be small, medium enterprises, so startups to medium to larger biotech, all the way through to pharmaceutical companies, if you think it's going to add value to involve them in your program. And we do have a commercial collaborations policy. So we'd encourage you to read that if you do want to include industry, and also to contact the office. and we can have a call with you to make sure that we give you the best advice on how best to move that forwards, and if there's any additional information that we would need. And I just would like to stress that, especially for that larger biotech pharmaceutical company level, it would be great to think about leverage. It would be great to think about how we could do more together. So potentially, are there in-kind contributions that they could make? Whether that be through providing access to people, so time, experts, people with relevant skills, samples, consumables. I think we're really open to have that conversation. And finally, people affected by type 1 diabetes. So this is something that's really important to us, involvement in research. So making sure that the voice of the people that we're serving is reflected and they have a seat around the table. I just wanted to stress, and I know that Rachel and Chandrabala will go into more detail about this, we're not requiring you to have recruited a co-applicant who's a patient advocate at this stage. We just really want to understand what you think the opportunities are to involve people affected by type 1 diabetes in your research, potentially thinking about not just individuals, but how you could access kind of broader networks and hear diverse perspectives from people living with or affected by the condition. I also just wanted to touch on a number of questions that we've had in this space as well. So one question that came in is whether a postdoctoral research associate could lead an application. For this call, no. However, that's something that we're thinking about for some of the smaller future project grants. Whether funding can be issued in Europe. So yes, for the jointly led application. So we appreciate that if you're jointly leading an application, we would need to be flexible with that funding, but that's why we've asked that that principal applicant is based in the UK. And then if you are successful, we can talk about how the flow of funds could work. And then the last question we had was around the number that we're going to fund. Being open, we've allocated roughly 10 million towards this, so that could be between 3 to 5 programs. But something that we really want to stress is that we're flexible. We want to fund the best research, and so we will do all that we can if we get more competitive applications, whether that be working in partnership or thinking about how we could bring in funds maybe from other pots of money that we have within the type 1 diabetes grant, if it fits within other areas of this beta cell call remit. We're really flexible, but that's currently what we're thinking is the pot for this call. So now I'm going to hand over to Chandrabala, who's going to talk through the assessment criteria.
Great. Hi, good afternoon, everybody. So yeah, I'll just briefly go through the assessment criteria. A lot of Jess has already mentioned. But yeah, so just wanted to reiterate our ambition to tackle this beta cell challenge is really to support innovative and novel research around restoring beta cell function. So we're currently assembling a global network of experts who have a range of expertise from beta cell to stem cell science, transplantation to immunology, and areas that are also not as common, commonly seen in diabetes, such as bioengineering or nanotechnology. And then a subset of these experts will form us the beta cell scientific review panel. And depending on the focus areas of the applications that have been submitted, they will basically be reviewing the applications. And just to point out that the scientific review panel is different from the scientific advisory panel, which Jess mentioned earlier. So since this call is focused around translation, one of the criteria that will be assessed is the translational impact and the potential difference the research will make to the lives of people with diabetes. And this could be preclinical with some clinical aspects. And as Jess mentioned, whilst we're not expecting a clinical trial at this stage, we would, of course, welcome early phases of clinical trials as part of the program of work. The next is around innovation and novelty of the program. And we would welcome high risk, high reward research ideas. However, not all aspects of the program need to be of this nature. The third is around scientific excellence, and this would cover the remit of the program and how it would fit in the beta cell therapy landscape globally. It would also cover the quality of research, experimental and study design, including methodology, feasibility, and statistical aspects. The panel will also look at the breadth of the expertise of the research team that is required to deliver the program. So we strongly want to encourage collaboration amongst the beta cell community and other areas of disciplines to address the program. As mentioned by Jess, there's a breadth of expertise, and we really encourage to do this. And then the last sort of criteria is around track record of the principal applicant or joint lead applicants. By track record, we mean like various type of research outputs, not just publications, but any awards or achievements or any other contributions, then that would be great. And the panel will be looking for also leadership qualities and whether the applicants will be able to lead and deliver the program. So at stage 1, which is the expression of interest, it's really a short and snappy application where we just want to know about your research idea and the potential of this idea. The scientific review panel will review and shortlist the stage 1 applications, and their feedback will be provided to shortlisted applicants, which will help build the full application. And if you have any queries regarding any of these aspects, you want to discuss any ideas, we're more than happy to discuss it over a call. So yeah, please do not hesitate. Next, it's around the next set of criteria is around grants advisory panel, and this is the panel of people affected with type 1 diabetes. So involving people affected by diabetes in our research funding processes ensures that the research we fund is relevant, important, feasible, and of benefit to people living with diabetes. At the EOI stage, which is expression of interest stage, GAP will review the shortlisted forms and give constructive feedback around the plain English summary and the patient and public involvement plans to help build your full application if you're successful at stage 1. So just to highlight that GAP will not be involved in shortlisting the stage 1 EOI applicants. So just a bit of detail around the criteria. So the first is around plain English summary and the communication of research. So how clear and easy it is to understand the research being undertaken, and this will include aims or objectives, rationale, how the research will be carried out. And we advise you to avoid any technical jargon or scientific terms, and please do explain any abbreviations that are being used. And then the next criteria is around patient and public involvement in your research. And the panel will be reviewing your plans of how you intend to involve people with type 1 diabetes in the different stages of your research. For example, you could form an advisory or a steering group or a focus group who could give feedback on things like your research question, research design, or even progress of the research. The group can also get involved in writing or reviewing your plain English summary. And you could also disseminate your results to get and then get any feedback or comments on how to advance the research. And just to highlight that at this EOI stage, we just require the PPI plans. We don't expect you to have already involved people with diabetes. So it's just your what you intend to do. And then for the full application at stage 2, GAP will assess the above criteria and whether you've taken their feedback from stage 1 on board. But they'll also assess the potential impact and the difference the research will make to the lives of people with diabetes. So things that they will sort of consider is, will this piece of research most effectively address the unmet need of people living with diabetes? Has the applicant made a meaningful attempt to demonstrate how their proposal would lead to a positive impact, including improving in the quality of life in both short term and in the long term? And the GAP panel, they love seeing some stats, so it'll be good to include percentage of people that the research will have an impact on. So all these criteria, will really be important for you guys to address. And then if you're invited to submit a full application, you must include a named patient involvement co-applicant who is part of the research team and clearly detail their involvement in the program and how they will be supported. And that's it. I'll pass it on to Rachel.
Thank you, Chandrabana. So I'm just going to talk through the application process for the beta cell therapy program grants. So this funding call has 2 stages, as Chandrabala has mentioned, an expression of interest or EOI stage and a full application stage. And this is actually a first for us at Diabetes UK, which is very exciting. So today I'll mainly cover the stage 1 EOI applications, but I will touch on the stage 2 timeline as well. Further information on the stage 2 full application will become available in due course as we're finalizing details, because we want to allow for flexibility and speed during this funding call. So firstly, the key date to take away from today is Friday, the 28th of April. This is the deadline for submitting stage 1 EOI applications. But between now and then, we want to offer support however you need it. So for example, if you would benefit from a discussion with us about your research proposal or a certain element of it, or if you have an idea that you're not sure fits within the scope of this call, then you can email us or we can arrange a call to talk through your ideas. It's very much up to you. And we also do want to hear about ideas that might be outside of the beta cell space, which might fall into one of our other funding calls that we're planning as part of the Grand Challenge initiative. And we also want to hear your feedback for us around the design of this funding call. As I said, a 2-stage round like this is a first for us, so we welcome your feedback. So after the submission deadline, your EOI application will go through an external review process. So this will firstly include scientific review by a subset of our reviewer college, which, as Chandrabala mentioned, will form our scientific review panel. The scientific review panel will shortlist applications and will provide top-level feedback on your proposal at this stage. Our grants advisory panel, or GAP, will also read and assess the applications, but only those shortlisted by the scientific panel. So as Chandrabala mentioned, they'll provide feedback on your plain English summary and patient and public involvement plans, but won't influence decision-making at this point. So the stage 1 review and feedback aims to help guide you when building your full application, but it won't be a deep dive review at this stage. Again, I want to emphasize that we're not expecting a full plan from you yet. And we will also provide our review panels with detailed guidance to reflect this. We hope to invite successfully shortlisted applicants to complete a full stage 2 application around the end of June, around July. This is depending on the number of applications that we receive. So I'm going to move on now to discuss the stage 1 expression of interest application form and what we're really asking of you. So the stage 1 EOI form is a shortened version of a usual application form. So in this, we're asking for top-level information about your research idea. And this table kind of outlines the key things to consider when completing your application. So firstly, program summary. So this includes things like program title, duration, scientific and plain English abstracts, and importantly, the focus area of your research. Here we want to understand whether your research will focus on beta cells fit for transplantation or beta cell regeneration, etc. Next, program description. So this includes an outline of your plan of investigation and the translational potential of your research. So here we want to gauge the translational impact of your proposed research and the innovative strength of your proposal. So as this call is focused on bench to bedside translation, this section of the application is key. Next, details of your research team. So this will include an outline of who your team are, so including joint lead applicants, co-applicants, collaborators, and this will involve information like their CVs and publications and their role in the project. But we really want to know about the collaborations that you're exploring. We're asking about your team to almost know what they're bringing to the table in a sense, so their unique perspective, as we're encouraging multidisciplinary collaborations. So this is what we want to hear about. So next, any patient and public involvement activities that you have planned to carry out as part of your research. So again, we aren't expecting full plans yet, but we want to hear your ideas so we can also know how best to support you with PPI in your research. Next, other sources of grant funding. So what we're asking here is we want to understand how this proposed programme of work is discrete from other projects that you have carried out or are carrying out. So we want to know whether there's any overlap between the proposed research and also to ensure that we aren't double funding. And finally, the finances section in the stage 1 EOI form is very top level. So we want to know an estimated total cost with a very brief justification. And we also want to know whether you expect to have any substantial equipment or consumable costs, and whether your institution will contribute to the cost of any high ticket items such as this. So all of this information and further details are available on the first page of the online application form. The first page is titled Instructions and it goes into detail on that. Okay, so as I said, I'm not going to go into too much detail on stage 2 at this point. We will provide more in-depth details at a later date. But again, the key point to take away is the stage 2 full application deadline on Monday, 14th of August. Briefly, the stage 2 full application will require in-depth details about your research proposal in the sense that you're probably more used to filling out. We encourage you to take into account any feedback provided from the stage 1 review when building your full application. Stage 2 full applications will be reviewed by the same scientific review panel as at stage 1, but this time GAP will also be influencing the decision and will be shortlisting applicants, as well as providing further feedback. So we aim to hold interviews in the first week of October / early October, and we will be holding these online.